I think the thing with behaviours is that people behave according to how they perceive the situation, and the easiest way that a carer can identify the meaning behind a behaviour is to ask themselves, what would lead me to behave in this way in this situation? If you ask yourself that, you become kind of like the detective, not the judge, and it really helps to get to the heart of what's going on. And pacing as a behaviour, for instance, just like people pace when somebody is late arriving, quite often people with dementia will pace because they're feeling anxious. And also they'll sometimes pace because they are listless. There's a thing called akathisia, which figures quite a lot in dementia, and that's the inability to settle for any length of time. So there will be a drive for them to get up and move about and move about. Another reason that people pace is, again, the same reason that we pace when we've got nothing better to do. We'll move about a lot, we'll potter, and often pacing is pottering. Sometimes pacing is just plain walking. It's walking about and looking for something of interest.
I'll be getting, physical activity is actually really important to allow somebody to let off steam. So perhaps they're just bored. They need something to do and go for a walk.
With people who pace, I would say that the best strategy would be to pace with them, to walk along beside them, to normalise the behaviour, perhaps to have a conversation. If you can, then take them outside and have a good long walk, because the best way for somebody to sleep at night is to be walking about during the day. If you're trying to keep them contained or settled, you're going to have them falling asleep during the day, and then you're going to end up with them being awake and alert at night. So I think it's, with any sort of movement-based behaviour, the best thing that you can do is move with them.
And how different is shadowing then? So you often have partners where one will shadow the other, and they find that extremely, it makes them very anxious, and they don't feel like they have any time to themselves. So is that different to pacing?
Shadowing is an inevitable consequence of the mid-stage of dementia. That's when you see it, at that middle stage. And a lot of it is to do with reassurance seeking. They want to know that you're close by because you're their lifeline. So if you're in the garden, they'll follow you in the garden. If you're in the toilet, they'll follow you into the toilet. It's something that carers have to, in a sense, get used to some degree, because it's not going to go away. You step back, you're treading on them. If you can try to engage somebody in an activity, but you'll find that they will still seek you out because the attention span won't be there. Usually they'll move through it to being perhaps more apathetic or more lethargic, but very often that stage will extend to quite a long time.
They experience a lot of anxiety then with their shadowing, they don't really want to be left on their own. Yeah,
because without you they are very, very stuck, and although that doesn't take higher executive function for them to think about that, that's just a survival instinct. So where you are is a place of safety, and that can't be emphasised enough. You represent safety, you represent life to them, you represent the ability for them to function, and so they need you in range. Without you, they're stuck.